What's mental health?
He asks all the questions everybody wants to know.
It basically includes our emotional, psychological, and social well-being.
You're driving me half out of my mind, you crazy old coat.
It affects how we think, feel, and act.
Oh my God.
Not just that, mental health helps to determine how we handle stress, and other things as humans. The Mind Clinic, a platform where people can talk about issues directly or indirectly on mental health.
It's time for the Mind Clinic. And by the way, the Mind Clinic is brought to you by Neem Foundation. Now, when we discuss mental health on the show, a lot of people call in on the program to ask questions. Some others send messages on WhatsApp. We get a lot of commendations saying, oh, this program, I listen all the time. I can't call in. Yes, we have a culture of silence in Nigeria, and some people are really shy and might not be able to ask the questions live on air. I do promise to give you an email that you can send your concerns to at the tail end of the conversation today. My name is Victor Pepple. I've got Chinyerugo Udensi on the program this morning. Good morning.
Morning, Victor. How are you doing?
I'm very well. How are you?
I'm all right.
Thank you. You're the first person to ask how I'm doing this week, and that's a good one.
This week?
Yes.
We need to get better people around you.
Oh, wow. Well, on the show this morning, we have a psychologist, a drug reform advocate and advocate of the Psychofeeble Foundation, a youth-led non-governmental organization set up to raise awareness for mental health and provide mental health services. She's also a national trainer on the Universal Prevention Curriculum for Substance Abuse developed by the United Nations Office on Drug and Crime. Sandra Anyaebi is our guest on the show. Good morning, Sandra.
Good morning. How you doing?
Well, very well. Glad to have you join us this morning. All right.
Yeah. So it's glad to have really good research people that come to add value. Excuse me. That come to add value to our conversation. So today we're talking about living with a mental health challenge. Over and over again, we keep on having that narrative that every individual has a mental health. Everybody has a mental health. It's part of your existence. It's part of who you are. And that's what controls your ability to live within society and to function within society. But then on the other hand, we don't all have a mental health challenge. And that's one thing that we want to keep telling people, that everybody has a mental health, but not a mental health challenge. But now we want to start to talk about the mental health challenges that our mental health can face. So I guess to you, the first question I would like to know is, what challenges can an individual's mental health face?
Yeah, so thank you very much. You see, like you mentioned, we all have mental health, right? A lot of people, most times, like there was an event we had some time ago, and one of the very first questions we ask people is, please put up your hand if you know you have a mental health. And only 3-4 persons confidently put their hands up. Others were skeptical, some were very sure that they do not have a mental health. And then I was like, no, we can't say if you have a mental health illness or a mental health challenge or a mental health problem. So people need to understand that the fact that we are raising awareness for mental health, talking about mental health and things like that, that does not mean that every single person is sick or has an issue with their mental health. It's just like a physical health. You can be healthy and you can be unhealthy. You can have issues here and you can be very fine tomorrow. So there's that. And then also people tend to think that when it comes to mental health challenges, you have to probably pull up your clothes and be running around the road before you can have a mental health issue or a mental health disorder or things like that. That is not exactly what we're saying. Though there are mental health disorders, yes, there are mental health disorders, then also people could experience just some sort of like an upsetting balance to your mental state, your mental health. But that does not necessarily mean that you're suffering a mental health disorder. Right? Just like how, for instance, you could have maybe someone, you're not feeling so good. Let's say you wake up in the morning and you're not feeling so good, but you don't have malaria, or or you don't have any form of medical condition, but you're just not feeling too well. Yeah, that doesn't mean you are completely sick or that you have one cancer or you have something of that nature. So people, you just need to bring it home. When you hear mental health, I need people to think, okay, it's not that it's one bad disease or it's one bad illness like that. Yes, it's a terrible something, but then again, we need to be able to understand that this is something that can happen at any point in time to anybody of any age. And with that, it will help us sort of like normalize it, and people will become more familiar with it. So you could have a decline in your mental health, and that doesn't necessarily mean that your mental health is terrible or is completely bad at that point in time. And then we have, a lot of people know the typical mental health challenges, typical mental health disorders like anxiety, mood disorders, substance use disorders, eating disorders, and all the rest. Those are the classified and diagnosed mental health disorders. But then again, someone's mental health can literally suffer, probably because he's been stressed a lot lately, or he's just experienced something that is taking a toll on you, or something of that nature. But that does not mean that you had a typical mental health disorder. So it is okay for your mental health. It is okay to experience a decline. But like we always say, the best thing is always to prevent having a full diagnosed mental health disorder. So the best thing is when you notice a decline in your mental health, always find help and speak out about it. So you can get that.
Yeah. So just like our physical bodies can experience challenges, our mental health can experience challenges. And the conversation that we're having, or what you said is that the fact that you may experience a challenge, like some form of stress or pressure may be put on your mental health. We all know within ourselves when we feel like something is off. We know when things are not right, and that's the point where we should actually seek to remedy it before it goes into a full-blown diagnosis or diagnosable disorder. And I think that's something that we need to take home. That a lot of the times, whenever our clients come, it's when things are almost at the tail end of an exploded problem, and you wish that the moment they notice something, they would just even if you just ask a question, is this what's going on? It will help you and it will help the person take back control of their mental health so that it doesn't deteriorate. And I think that's a great one. In the conversation that you have, you mentioned some mental health challenges that people can face, maybe mental health disorders that people can be diagnosed with. I wanted to ask, from your practice of working with people, what are the common mental health challenges that we find that Nigerians experience? What are those common ones that we see?
So, the typical Nigerian, right? The most common mental health disorders that most Nigerians get diagnosed with is depression and anxiety. That is it's like at the top of the list. It's just there, like depression, anxiety, every single person. Like a lot of people, you see a lot of people being diagnosed with much more with anxiety, much more these days. Especially because of this pandemic, a lot of people have more sort of anxiety or the other. So depression and anxiety is really at the top of the list among all the other challenges. Depression and anxiety is at the top of the list.
Yeah. And could there be, are there other ones that maybe that are not really on top of the list that most people are diagnosed with?
Yeah, there's a lot. We have PTSD. Okay. Post-traumatic stress disorder. There's substance use disorders.
Yeah.
This is also becoming a really big issue these days. There's substance use disorders. There's especially also in this pandemic, there's OCD. Eating disorders, and all the rest, so like schizophrenia, psychosis, and all the others. But anxiety, depression, PTSD, substance use disorders, these are like at the top of the list in among Nigerian individuals in Nigeria.
Yeah. You just said something that was quite interesting. In this pandemic, during this pandemic, there's an increase in OCD. I think, it's an obsessive compulsive disorder, and I think, wow, that was quite interesting, because you understand that with the pandemic, the rules, you have to do certain days, the rituals that you have to do to ensure that you are, that you don't contract the virus, and then people can now decide to begin to obsess over it and just keep on repeating that behavior and the thought, and it's very easy for us to have that, have the symptoms of OCD as a result of the pandemic, and that's something that we do. We're not very conscious of. Well, I'm glad you talked about it, and I'm glad that you mentioned it. So I wanted to find out, how long can an individual with a mental health challenge live? Like, how long can they live with the mental health challenges? That's the first question before I go to the next one.
Okay. So I have also had a lot of people who ask these questions, and people are like, if you have probably been diagnosed with one disorder or the other, and how long do you have to be to therapy for? How long do you have to be how long will this disappear? How long will I'm cured and things like that? As much as there are treatments available for some mental health disorders, unfortunately, some cannot be cured per se. But then there are also effective treatments that can help manage those disorders. Some mental health issues last a lifetime, unfortunately. Some last a lifetime. Some could, for instance, there are not people who, like I mentioned, top issues we have in Nigeria, like anxiety and depression, but particularly anxiety. A lot of people get better. A lot of people overcome their anxiety. But then again, there are also some issues that some people cannot just get over just like that. Some mental disorders do not have a cure. But thankfully, they can be managed. Therapy, their medications, just seek professional help, and you'll be able to get the right solution or treatment plan for you. So that's one thing people need to understand, especially people going into therapy. We need to get this off our head that, okay, once I go to therapy and come out after my first session, everything's going to be fine. No. Exactly. It's a process. It's a gradual process. And I keep telling people, even general mental health, it's a process. It's not a destination. You need to understand that it's not a destination. It's not something you do like, oh yes, I have a perfect mental health now, so yeah, I'm good for life. No. It's a process. That's why they keep protecting your mental space. Because at any point in time, you could experience some sort of trigger that would bring up or cause you to experience mental health challenges. So how long? Like I mentioned, there are treatment plans that could help people manage and cope and live better. I've seen people who have been diagnosed with what some people would say is probably the worst of all mental health issues. But yet again, they're living their life fully, because they have found a treatment plan that works for them and have continued to grow in that line, and they're developing and becoming better. So that's one thing to keep. It's a process. It's not a destination.
Yeah, 100%. It's a process, and I think one of the most important things is once you get that process and you find what works for you, you can actually live a fulfilled life. You can live quite a productive life, because most people, they begin to worry, I'm taking this medication, it's affecting me this way. It means that, I can't be the person I used to be, or I can't do the things I used to be. With part of your treatment sometimes comes with a change in your lifestyle. It's an adjustment that you have to make. You do have to make these adjustments to accommodate the new lifestyle that you have, that is part of your treatment. Because sometimes clients have that problem of, you want to be on the treatment, but you want to keep doing the old things that you have been doing that are affecting your mental health. You can't keep going back to that place that affects you. You have to embrace the change and the new treatment or the new plan forward for your life, so that you're able to live a healthier life. And, the truth is, people can live, with their mental health challenge and live a good life. You can live a good life. You can live a very productive life, with the right care, with the right support. It's not a death sentence. The fact that you have an anxiety disorder, or the fact that you may have schizophrenia, or you may have anything, it's not a death sentence. like every other health challenge, with the right treatment, with the right care, with the right support, you can live a good life. And I think that's one thing that we need to take home. We need to take home from the conversation that we're having, even with the mental health challenge. Victor?
All right, we'll take a break. When we come back, we'll get to some of the listeners at this time to read their comments as well as questions on WhatsApp. But let's take a message from Martins. Martins is in Dawaki. Martins sent a message to us and he's asking, what are signs of mental illnesses? He goes on to ask, can mental illness go away?
Is that for me?
Yes.
Yes. Okay. So, the thing you just, I think we also answered the last part of the question. Can mental illnesses go away? I think we already sort of covered that when we mentioned how long can individual experience a mental health issue. So can a mental health illness go away? Like I mentioned, if you're just having some form of challenge whatsoever with your mental health, with appropriate help, with the right professional help, yes, you can, the therapist or your psychologist or whoever you need would be able to provide solutions and treatment plans for you. But for some mental health disorders, there are some mental health disorders that do not just go away, right? There are some mental health disorders that need to be diagnosed and properly treated. Some mental health issues, like you mentioned, will last a lifetime, but with proper treatment, it can be managed and put and you'll be in control, and you'll be able to live your life fully and however you want, right? Also, for the symptoms of like a mental health issue. So, first of all, I always tell people, if you feel, because the truth is, most of the time, we already know if something is wrong inside of us. We know, if you feel it, you know something is not right, right? So, most of the time, when you feel like this, the best thing is just to speak up. Therapy is not just for severe mental health issues. People go to therapy for, probably just to talk out their emotions, just to gain clarity in some area of their life. There are so many reasons why you could go to therapy. So it's not just because you've been diagnosed with one mental health disorder. So some of the symptoms that you need to keep an eye on, changes in mood, changes in the way you perceive things, your obsessions. You notice that you've developed some form of maybe new obsessions, and especially unhealthy obsessions. You develop some healthy coping mechanisms. You also need to keep an eye out for, fear and anxiety. So these are like things that you can just keep an eye on to help identify and also keep your mental health in check. But these are not typical symptoms for like different mental health disorders. These are just for you to, have like a general knowledge of when your mental health is beginning to decline or something of that nature. Because different mental health issues have different symptoms. So the best thing is, if you notice that you're